Welcome to Quaderno Academy, empowering excellence through education. Join us as we inspire growth and unleash your potential. Let's dive in.
So, you're thinking about hip replacement. It's a big step, for sure. But what happens after the surgery? Well, it doesn't have to be a mystery. We've put together a really clear step-by-step guide. Think of it as a roadmap to help you navigate your recovery successfully.
So are you ready to get started? Let's walk through this roadmap together, all the way from getting ready for the big day to getting you back on your feet and doing the things you love. Okay, our first stop is all about preparation. This is the phase where you really get to take some control. Do everything you can before the operation to set yourself up for a much smoother recovery. You've probably heard this term rehabilitation floating around, but what is it really? Well, it's pretty simple. It's a program of exercises and education that you do before surgery to get your body and, just as importantly, your mind ready for what's ahead. Now, here's something that's really important to understand about prehab. The research shows it's fantastic for boosting your confidence and your quality of life leading up to the surgery. But, and this is a big but, it doesn't have a huge effect on the long-term results. The real gains, the lasting success, comes from the dedicated rehabilitation you do after the surgery. So think of it this way. Prehab gets you to the starting line, but it's the post-op rehab that gets you across the finish line. So what does prehab actually involve? Well, it can be a mix of things. We're talking gentle exercises to strengthen the muscles around your hip, some balance and stretching work. For a lot of people, aquatic therapy, exercising in the water, is a total game changer because it takes all that pressure off your joints. And it also includes education, which is huge, so you can walk into that hospital feeling informed and ready. All right, you've done all the prep work. Now we're at the main event, the surgery itself, and those first critical steps of your recovery. On surgery day, the process is actually pretty straightforward. First, you'll get anesthesia to make sure you're comfortable and pain-free. Then, the surgeon does their work, replacing the damaged joint. And right after that, you'll start your recovery, usually spending just a few days in the hospital. And here's one of the most important things to know. You will not be stuck in bed for long. Getting you moving early is absolutely key to a good recovery. In fact, a physical therapist will be there to help you get up and walking very soon after your operation. It's all about kickstarting that healing process right away. Okay, so you're home from the hospital. Now what? Well, this next phase is all about rehab, rules, and recovery. This is where we navigate the path forward. Your physical therapist is going to be your best friend here, but the exercises themselves follow a pretty logical path. You'll start with the basics, right? Gentle walking, practicing getting up and down from a chair, and then from there, you'll slowly build up to things like leg lifts and balance exercises, all designed to get your strength and mobility back safely. Now let's talk about some really important safety rules. These are pretty much non-negotiable, and they're all about protecting your new hip while it heals. The big ones are, don't bend your hip more than 90 degrees, don't cross your legs, and try not to twist your hip. And just as critical, make your home a fall-proof zone. Get rid of those loose rugs or anything else you could trip on. And hey, please remember, you are not doing this alone. Study after study shows that having support from your family and friends is a massive motivator. It's that encouragement that helps you stick to the plan and, honestly, just keeps your spirits up when you need it most. Okay, let's shift gears for a minute. For older patients, the recovery journey can look a little different, so it's really important to have some specialized guideposts. As you can imagine, the recovery path can really change with age. For older adults, it's often a bit slower, and the risks we need to look out for are different too. Things like delirium, infection, and falls become much bigger concerns. And that's exactly why having ongoing, really solid support is just so crucial. Because of those higher risks, recovery for older adults is definitely not a solo mission. It's more of a team sport. It involves a whole team of people, doctors, nurses, therapists, sometimes geriatric specialists, all working together to manage any other health conditions and make sure the recovery is as safe as it can possibly be. And that brings us to an incredibly important person in this journey, the caregiver. Their role is absolutely critical, especially if the patient is dealing with any cognitive challenges. Delirium, which is a state of sudden confusion, is a really serious risk for older patients. But here's the good news. It's often preventable. So for caregivers, this checklist is golden. We're talking about simple but powerful things like making sure glasses and hearing aids are actually being used, encouraging movement, keeping the room calm and familiar, and focusing on good sleep and nutrition. It's also vital to be on the lookout for certain high-risk medications. And beyond preventing delirium, there are other key things for caregivers to keep an eye on. You'll be watching for any signs of confusion, of course, but also helping with daily activities, preventing falls, checking the skin for any sores, and helping manage all those medications. And being an active partner in planning for going home from the hospital, that is essential. This is so important for caregivers to hear. For patients who have cognitive challenges, recovery isn't always a straight line up. The research actually describes it as a slow, drip-like process. It's not a flood of progress all at once, but a steady, gradual improvement. And that means that patience and consistent, gentle support are the most powerful tools you have. And I just want to circle back and really hammer home one of the most powerful items from that prevention checklist: mobility. Seriously, the simple act of helping the patient get up and walk, even if it's just for short distances, at least twice a day, it is one of the single most effective things you can do. So what this all boils down to is that a one-size-fits-all plan just is not going to cut it here. The rehabilitation program has to be tailored to the patient's specific cognitive status. Every single strategy needs to be adapted to what they need as an individual for it to really work. You know, after all these details and precautions, let's end on a really high note. The research is very clear. Most people do very well after hip replacement. Staying active and sticking to your plan, that is your direct path to getting back to the life and the activities you enjoy. So as we wrap up our little road trip here, I want to leave you with a final thought to hold on to. What's that one thing, that first activity, that you were just so looking forward to doing again? Keep that goal right in front of you, because that's the destination at the end of this successful journey.
Brought to you by Quaderno KO. Learn smarter, not harder.